One of the first things that I'm going to do is go through a general, broad overview of what I'll be talking about today. I'll be generally introducing the topic, starting out with my rationale and the general implications of this review as a broader literature review of pretty much all existent literature and current findings on step-family functioning. Then I'm going to present some of those. Basically go through the highlights from the literature in terms of step-family functioning. I'm going to touch a little bit on systems theory, so that basically we're all not going to go too much in depth there, but so we all get a general sense of where I'll be going in terms of describing step-family functioning. Then I'll be talking a little bit more specifically about the difficulties faced by step-families, and then talk about the clinical implications. What are the big issues? What are the big issues that come across in terms of the research, but also what are the big issues that come across in terms of clinical work? What mental health care professionals are likely to see in their offices. Big issues. Discipline right off the bat. Discipline is a hot topic within the research literature, but also probably the #1 topic that comes in to our offices in mental health. And I have to say that it's a big issue for step-parents, but also for children, adolescents. The next, probably biggest issue is relationship. So relationship difficulties that step-families encounter, and I'm going to talk about some of the relationship improving strategies, that have been noted in the research literature, and also in the more specific clinical literature as well. Then at the end, we'll have a bit of a discussion, really, about what's the bottom line, what can we take away from this, what are the major findings, and where do we go from here. So I'll go back to the introduction just for a minute and discuss really the main purposes of the presentation today. Are, as I noted, to describe the current research literature in the area of step-family functioning. I conducted a broad search looking at evidence-based practices, evidence-based research on step-families, and I looked at journal articles, books that discuss valid research findings, and also seasoned professional findings, recommendations, and I basically compiled all of that. So what I'm going to be presenting today are the major findings from that broader review, and I'm also going to be discussing some of the clinical cases that I've seen. The secondary goal is going to be to examine those issues in a bit more detail and to discuss how we can generally improve step-family functioning. So who are step-families? Who makes up a step-family? One of the interesting things that I noted as I did the literature review was that there seemed to be a variety of descriptors. So I found, descriptors including blended families. So when a step-parent brings in his or her biological child into a step-family, reconstituted families, more of an older term used to represent the step-family. That one's pretty much fallen out of favor at this point, as it implies more of a rebuilding process, more of a copying of the nuclear family, which isn't really accurate. Complex families, simple stepfather families, simple stepmother families, those include families where either the mother or father is not biologically related to one child in the household, but where the other parent is, so be it the mother or the father, is related to all children in the household. So the only point I wanted to bring up there was that there exists a significant amount of variation in the definitions used to describe step-families. For the purposes of today's talk, I'm going to be using the term step-family, step-parent, stepmother, stepfather, and I'll be using either biological parent or natural parent to denote the non-step-parent family, parent in the household, One thing I do want to note, this definition really being the primary definition that you see across research studies. One thing to note is that I emphasized here presumed. presumed genetic parent, and also that the other parent is of the opposite sex living in the same household. And it's important to note that that's not always the case. There's not a lot of research on those more specialized cases. Although a lot of this material will pertain to those specific families, it's important to note that there are slight differences there that ought to be considered. So if those specific situations pertain to anyone here today, there are any specific questions, I'd be more than happy to discuss them afterwards. So step parenting has really become a fairly predominant issue among mainstream families. Really the main reason is that we've seen an overall increase in the amount of divorces. Right, that's not new to anyone here. More recent studies have shown, well, generally 45 to 50%. Here I'm presenting a little bit older study that showed that 35 to 50% of kids at some point in their lifetime are going to experience living with a step parent. And if we step back and think about that for a minute, that's almost 1 in 2. That's a lot of kids that experience this type of living situation. So it's not really that uncommon nowadays. One of the interesting things that I came across in my review was the Darwinian view of step parenting. It really described animal behaviors and talked about in the animal kingdom how parenting the offspring of another is generally viewed as wasting resources. In the wild, the idea of ensuring another's reproductive success can be detrimental to one's own survival and the survival of one's own offspring. As humans, we're generally not going to be eating our young, such as the lion does in the same situation. Okay. However, it's an interesting take on the same phenomenon. So, again, an interesting addition. Excuse me. What we see as being different, I guess, in the general population in terms of general step family functioning is that there's this surprise when things start to go wrong. Okay, so as I said, the animal kingdom, they're ready for it, they're acting on it initially. But we are generally more likely to experience this honeymoon period, this honeymoon phase, where expectations are high. There's a period of idealism, of fantasy, the expectations for that instant love connection. I've had families in my office where a stepfather, stepmother has said, I love your mother deeply, therefore I love you. And what we know about interactional patterns is that there generally isn't an instant love connection, especially among families where suddenly these people are thrown together. So it would be nice, and we often lean towards that, but it just simply isn't the case. Having said that, virtually all families have this honeymoon period. So the expectations are high. They have that romantic notion, excuse me, rather than a realistic notion. For many step families, their belief about how they should be, how they should interact, how they should get along takes over. And what ends up resulting is a significant amount of distress and letdown once that honeymoon phase starts to fade. So it's almost as though step families set themselves up for failure just simply based on the expectations that they have for success at the very beginning. So inevitably, there'll be clashes. Inevitably, there'll be difficulties that families have to overcome. Having said that, intact families experience the same types of things, right? No family is entirely, is going to escape entirely without conflict and issues through the course of child development. It becomes particularly important for step families because of the expectations that they have for success. We'll see increase in child behavior problems shortly after the honeymoon phase. So I'll have families come in and say, everything seems so great. He really liked the stepmom, he really liked the stepdad, and then all of a sudden, out of the blue, we're having problems. That type of thing. So inevitably, there's going to be difficulty. Inevitably, there's going to be, well, some general increase in some types of problems. Children are going to show some form of distress. It's going to be different across the population. So it's going to be different for all children. It's going to present itself in different ways. But oftentimes we see increase in behavior problems. We'll also see increases in feelings of sadness. And loss may really overtake the stepchild. The theme of loss resonated over and over and over again, both in the research literature and in the clinical literature as well. The child is forced once again to adjust to a new family and a new way of life. Issues are initially likely to revolve around discipline and developing the step-parents-stepchild relationship. But what we often find is that the issues, although that's what they present with, the bigger problems have to do with problematic interaction styles. So manners in which families interacted previous to the introduction of a step-parent that are holding on tightly so that the step-parent is not able to infiltrate the system, or the type of thing where the new system just doesn't function as a well-oiled machine. I'm going to elaborate on that a little bit later. What we know about children living in step families is that when we compare stepchildren to children in intact families and single-parent families, they experience increased behavior problems, increased internalizing problems, so increased worries, feeling down, that type of thing, and increased family dysfunction, and increased rates of divorce and remarriage. So what we know about the statistics of step families is that once there's an initial divorce, the odds of further divorces are greater. So as I had mentioned before, the aim of this talk is really to review that literature and present those major findings. As I talked about before, I'm going to just touch on systems theory here, just as I said, to ensure that we're all on the same page as we proceed through. Systems theory is very popular but also empirically established theoretical approach for family work, and also has been shown to be highly effective in dealing with step families. Most work with step families focuses on the interaction between family members. So oftentimes families will come in and there's issue after issue after issue, but when everything is teased apart, it ends up being that there's specific interactional patterns, the system works in a certain way that is reproduced over and over and over again. So this theory is generally applied to work with step families because it's addressing the fact that there are pre-established ways that these families have functioned, and that likely they're going to be bringing in those problems, those differences into their step family, which is also going to increase stress. So initially we want to find out how are they functioning as a whole, how are they functioning during a problematic situation, who's the one that gets frustrated first, who goes and tells on who tries to align with who's likely to blow up at who's likely to withdraw, who's crying, what's happening in terms of that system reaction, because this is a new group. They're learning how to interact with each other, and it's really important to sort out overall what are those patterns. So as I said before, focusing on the dynamics of the interaction rather than on the specifics of the argument. As I also mentioned earlier, stepchildren are at greater risk of maladjustment and low self-esteem as well, also compared to other families, both being intact and single-parent families. Excuse me. And again, adjustment and loss ends up becoming a huge issue again. What we have found is that this area is largely overlooked with step families. Oftentimes, stepchildren that discuss their loss are seen as complaining within families. Step-parents may feel uncomfortable when a child describes the fact that they've experienced a loss, that things were better at another point before somebody else was on the scene. And it ends up being uncomfortable. So oftentimes families end up shutting that part down. So the child is not able to express their losses, they're not able to express their feelings of grief around some of the things that they have lost. So let's talk a little bit about why stepchildren are at such high risk. It's important to note that there's huge variation, and we may see some of these characteristics, some of the difficulties for short spurts. We may see them for longer spurts. They may come in and out. Children living in step families are likely to experience several family transitions excuse me, and a series of adjustments, gains and losses during their development. The impact of divorce alone on children is great. It's also important to consider that many kids will have been exposed to marital discord and the stresses that are involved in that as well. Also, they're going to experience loss. They're going to experience loss in a variety of ways. They're going to witness the exit of a parent within some capacity. So their family is going to look different. Even if there's joint custody in place, they're no longer going to experience the presence of one parent, which is, as you can imagine, stressful for a child. As a result of the dissolution of a marriage, the family routine and expectations give way. The family members generally experience significant amounts of anger, sadness, and overall shock that the family unit has collapsed. Having said that, research has generally shown that within 2 years, families have reestablished their balance. And that there are a lot of different phases that occur during that initial breakup to the point where they establish that homeostasis, that general balance, but that generally speaking, within about 2 years, everyone has been able to reestablish themselves. Behavior problems, emotional problems that have stemmed from the separation itself are likely to resolve at that point. Sometimes with the intervention of a mental health professional. There may also be family income losses. So children may be required to move to a different location. They're, for the most part, still today, mom is more likely to have full custody. So the family income is likely to change, and what we know in the broader scheme of things is that women's income is also likely to be less than that of her partner. Therefore, the family is in many situations likely to experience a decline in overall income, which is, again, a loss for children. They may end up losing their existing lifestyles and experience a variety of changes associated with that. New neighborhood, new school, and go without some of the luxuries that they may be accustomed to. There's also a recovery period. So researchers have shown that there are a variety of cycles, phases, adjustments that families go through, but that, as I said, generally speaking, within about 2 years, things seem to balance off again. There is also a period of time where parents generally do not function at their peak right after a divorce. It's a very difficult thing, obviously, for parents to go through. And what we often see is a slight decline in parenting as well, which can also contribute to some increased behavior problems, less one-on-one time possibly as well at that time. As I said, though, as they go through that cycle, parents pick themselves up for the most part, sort their issues out for the most part, and we see the kids popping up on the other side of that as well. In terms of the step parenting, excuse me, one of the other reasons for the initial distress that's been described in the literature is the social capital model. And according to this model, there's increased stress, increased time commitments and energy that are necessary to integrate a new family member. So if we think of catching a cold, if we're not eating well, if we're not sleeping well, if resources are low, then we're more likely to catch a cold. Same thing with this model. So if everyone's trying to deal with the general life situation, integrating a new person stresses somebody's new in the family, increased demands, new rules, that type of thing, then they're going to be a little bit more susceptible as well to experiencing difficulty. In terms of the theoretical model systems theory, there are a variety of different, what we refer to as dysfunctional triads that are found within the step family literature. And I'll talk about them now. A common one is a mother enmeshed, which is qualified by an extremely close relationship, excuse me, with her child, where all other family members are seen as a threat to their duo. In this situation, I don't know how clear that is, maybe refer to your handouts. The mother and child are going to be fairly close. So this might be the original father in the family, and the relationship between mother and child is going to involve really a relationship that's almost too close, we would say. Okay, so mother's going to be confiding in child a fair bit. As the arguing starts to ensue, as the dissolution of that marriage starts to be brought about, child is going to be more likely to take mother's side, and strain will follow with the father. And again, these could be reversed, could be mother or father. Here we see a mother-child coalition where there's a failure to accept a stepfather. Excuse me. So this would likely be the mother and child that had been very close initially, and then we have the stepfather who's trying to become part of that family. And because mother and her child are so close, it's going to be almost impossible for a stepfather to infiltrate that. When I came across different descriptors of this situation, I had one that was quite interesting, where a stepfather described how the mother, she would tend to take her daughter's side, and I would feel betrayed and left out. For a long time, I was getting the impression that her relationship with her was more important than our relationship. That really hurt me a lot, so I felt threatened. I guess I resented her daughter even more because of that. So again, we can see how in stressful situations that mother and child duo is going to bind together, and we're going to see that family pattern emerge over and over again regardless of the situation. Another common one, second most common one I would say, is the stepfather over-involvement with parenting. So here we see that the bond between child and mother is going to start to decrease. There's going to start to be problems there with the over-involvement of stepfather. The research in this area shows that the more stepfather parents, the more children dislike him, and the more that mother's mood declines. So the more difficulty she then ends up having in terms of viewing her family and the overall relationship that she has with her child. Excuse me. And then I would say probably the most common triad that we see, excuse me, is the scapegoating of the stepchild. So this is where the mother and stepfather, or stepmother and father, end up having additional difficulties. So their marital stresses, they're dealing with their new relationship, there may be other issues, someone may have lost their job, whatever the case might be, there's stressors, there's constraints in that marriage, but the stepchild represents a scapegoat, because the stepchild will end up doing things that are a bit irritating, may have some behavioral things, but all the focus is going to come on to that stepchild so that they don't have to deal with their current marital issues. Okay, I got a little bit ahead of myself there, so let's move back to that post-divorce, pre-stepfamily era. So what predicts a successful transition from single family to stepfamily? Key thing is effective grieving of that original family unit. Research has shown that if the children have grieved the loss of that original family unit, then when it comes time to entering into that stepfamily, they're going to be more able, more open to accept it. Also, research has found that if good communication was established prior to entering into the stepfamily, that it's likely to continue on as well. Not to say that there won't be issues that arise, but they're still more likely to have greater success. Some changes. So when I talk about grieving, it's important to really get a sense of what exactly are kids grieving. It's possible that they've had a move, which I talked about before. New rules. Families will often try to keep things constant, try and keep things as similar as they can, but inevitably new rules come about. And kids are not likely to be fans of that. Not to say that no new rules should ever come into play in any family, but it's important to recognize that that can be stressful. New family dynamics. So a mother and child who often watched a certain show together on a Tuesday night may no longer be doing that together anymore. Perhaps stepdad doesn't like that show anymore. Perhaps there's something else that's more important. So little things like that also are likely to come into play. And then also in terms of dynamics, a child in a single parent family is a parent is likely to confide a fair bit in a child. And it's possible, excuse me, it's likely, sorry, that those dynamics are going to change, that suddenly they're not sharing as much with that child because they have their partner there now, which to do that with. New expectations. From both a familial and individual level as well. Everyone, as I was talking about before, has big beliefs and hopes and dreams for what this new family is going to be like. Excuse me, and also on an individual level. So a child that hasn't experienced a father being around for a while may have also big hopes and dreams for what a stepdad, what a dad is going to be like. And oftentimes, it doesn't work out into a perfect situation. As we know, nobody's perfect. So I've mentioned this before, loss of one-on-one time with the biological parent as well, and loss of status within the family also seems to be a big one. And this one seems to be particularly a big one for girls. Little things such as rushing home from work and asking the child, I've got this or this tonight for dinner, which would you prefer? That child may then lose that later on. Maybe it's stepdad or stepmom that comes home and they're now making supper, and so little things like that that a child is going to lose in terms of how they perceive their status to be within the family. Having said that, it's important that everyone continue to function in an appropriate way. So it's not that children should have full say in order to maintain their status, but it's important to recognize that there may be a sense of loss there. I know if I go to work and I've been demoted, I'm not likely to feel great that day for a little bit longer. So that's just kind of a normal feeling that they're likely to have. Okay. Mental health problems among stepchildren. In the interest of time, I'm not going to go through these in too much detail. Suffice it to say that there are increases. There's increases in behavior problems. There's increases in diagnoses of conduct disorder, oppositional defiant disorder, anxiety, depression. We see things such as moodiness, withdrawal from peers. They also have increased health problems. Increased asthma has been found, increased headaches, increased bedwetting, and also being more prone to accidents as well. An interesting study showed that a lot of kids in step families end up being seen in mental health clinics for behavior problems. And one of the studies looked specifically at comorbid disorders and found that, in fact, approximately 70% of kids who were presenting with behavior disorders actually also had significant depressive symptoms as well. So these pieces were just being overlooked as a result of the behavior presenting. Why is it that we're seeing an increase in mental health problems, difficulty adjusting during that phase of, I guess, coming down from that honeymoon phase and the development of a step family? I've talked about these briefly. So generally a reaction to change, that there's so many things going on and that's that child's first line of defense is to react behaviorally. Or to withdraw from school, withdraw from peers, that type of thing. Loss of status within the family, I also alluded to that earlier as well. Another important thing to note is that negative life events also seem to have a significant impact on the initial stages of step family development. So if we think even of an intact family. When we experience a significant stressor, the loss of a loved one, the loss of a job, if there are learning difficulties that a child is experiencing, those are going to stress any family unit. What we find is that when something like that comes about during the initial stages of step-family development, it really seems to throw them off in terms of their trajectory. Excuse me. Discipline seems to be one of the biggest issues as well, both for families, but when adolescents are asked, they describe discipline as the biggest issue for them. And I'm going to talk about it a little bit coming up. What research has shown is that there aren't any differences in how step-families discipline compared to intact families. There are no differences. What happens is the adolescents don't like it. And so they're more likely to be trying to continue to make those changes. The more discipline that comes about, the more they're likely to really push that system. Having said that, many adolescents are not a fan of discipline, but when it's a biological parent that's putting it forward, adolescents react differently than they do with somebody else coming in and putting in a new rule. I'm going to talk about that as well. Different forms of discipline, the types that STEM parents are likely to be more successful with versus others. An interesting thing that came up in the research was societal stigma, and really that information is not debated very much, but the findings are pretty much all over the place there. It's such a common occurrence now that I think historically that was an issue. It doesn't seem to be as much now. And the adolescents that were looked at in the study, in these two studies, didn't find that it was a concern at all. They had no qualms with identifying themselves as being within a step family. So when we look at gender issues, when it comes to stepfathers, what we find is that girls fare less well. Girls have more difficulty, and I talked about this a little bit earlier. The general consensus in the literature is that stepdaughters stand to lose more. They are likely to lose more one-on-one time with their mothers, and they're likely to have more of an emphasis placed on overall family cohesion. So they're likely to lose their one-on-one time and have it turn into family time, which is really not advisable. It's important to develop this family piece. It's definitely a crucial component, but not at the loss of the one-on-one time. And I've seen it over and over again with the families that I've worked with where things seem to be difficult, the relationships seem to be strained, so off they go to do lots of family activities together to improve that relationship, improve those relationships and interactions. And as I said, great. But if they're at the cost of losing that one-on-one time, then there's no point. There's absolutely no point, because if those children lose their one-on-one time with their biological parent, then automatically we're going to see increases in a variety of difficulties. And their distress level is also going to be increased. That's a significant loss, a tremendous loss for them. Initially, we'd like to see that one-on-one time is maintained. And if problems arise, that it's increased. What I also tend to see is that when I make these recommendations, it's really hard for step families, because that means the exclusion of the new step parent. That means that that step parent has to feel comfortable enough with their parenting and with their self to step out on some occasions in order to maintain, in order for that initial biological parent-child relationship to continue to maintain what it has established over time. When that is successfully done, it's then important to build that relationship with step-parent. Okay, so it's not generally made into a really big deal. So it's not like girls' weekend away once a month and poor stepdad is at home for, you know, weekends at a time, that type of thing, right? But a specific emphasis on that one-on-one time that's not to be interfered with by the new step-parent is very important. And I have to tell you that from what I've seen, it's very, very difficult And again, it somewhat stems back to the beliefs and expectations that families have about what a step family should look like, and that time should not be required. And the truth of the matter is that it is needed, and it's a really important piece. Another side of why stepsons stand to gain, I guess, so stepdaughters are going to do worse with the introduction of a stepfather. Stepsons tend to gain. There's really two reasons for that. The first is it's possible that mom paid a whole lot of attention to stepson, and now she's diverting some of her attention away. So daughter wants the attention, wants it to be there. Stepson is saying, oh, thank goodness she's letting me have a breather for a bit, and is doing some of her own things. And as I said, that's just general gender differences. Stepson also, generally speaking, stands to gain. So if he hasn't experienced a father being around in a while, or certainly not a consistent father, then he's going to very much enjoy throwing the football around or watching something on the TV that's more gender appropriate, if you will. Having said that, it's not across all situations that we see. Every time there's a stepdaughter, every time there's a stepson. There is variation there, but when we look at the broader numbers, that's what we see. Stepmothers, poor stepmothers. They've got it the worst. There are no gender differences there. They have difficulty across the board. Doesn't matter the age, doesn't matter the gender. The general thought for this, when we view women, we expect that they're ready to parent, that they're maternal beings, that they know exactly what to do, that they know how to parent. We expect that when babies are born, that you know how to do it, that there are no questions that should be had. What we often end up seeing is that biological fathers have this kind of underlying expectation that stepmother can slide right into that role, that she knows exactly what she should be doing, and that the kids will accept her immediately. And for some reason, this just seems to happen more often amongst stepmother families versus stepfather families. Stepfather families, they're more likely to step back and let things go a little bit more smoothly. With stepmother families, the expectation is generally there. Again, not in all cases, but broadly speaking, the expectation is there that she'll parent right away. And that pretty much sets her up for experiencing difficulties, because the slow establishment of a good relationship is often bypassed by, again, expectations. As I said, not in all cases, but certainly seems to be the norm. And so, generally speaking, as well, that life stresses, as reported by parents, for girls. For girls tends to be in the internalizing and externalizing, so both the worry, depressive mood, feeling low, that type of thing, and behavioral problems as well for girls. But for boys, it's going to be more likely to be that external behavior problems. Age issues. Really important issues, and overall, the jury's out on this one. There really are a variety of findings. What I'll say is that younger children, it's believed that in general, younger children are more negatively affected because they lack a social network. So they're not able to contact their peers or be on the phone, or have even some of the cognitive skills sometimes necessary to sort out some of the difficulties that they might be having. And so they're likely to be going it on their own, right? They're going to have their family, their immediate family. If they happen to have additional resources, then that's great, but they're not likely to. Having said that, what we know about adolescence is that it's a really tough time, right? Anyone who has an adolescent, worked with adolescents, been an adolescent, knows that that's a really tricky time during development, if not the most. And what we find is that in that general circumstance, children are more likely, to adjust, to have positive experiences if they're introduced as a young child, because during adolescence the difficulty is almost certain. What we also find is that children who have coped well, who've integrated with a step parent, as soon as they hit adolescence, all of a sudden a lot of issues are likely to resurface. So again, that's largely why the jury's out. Having said that as well, research does show that younger children will have a bank of positive experience with a step-parent by the time they reach adolescence. That is better than not. The worst case scenario is, as I have denoted here, pre-adolescence. That's pretty much the worst time, and that's because this stage of life, the child, the pre-adolescent, is really starting to work on becoming an adolescent, so they don't necessarily have the peer support yet or access to it as readily as a full-fledged adolescent. But at the same time, they're going to start testing things, and so this is going to give them basically fuel for their fire. Across the research literature, I have found that there are protective factors. So as I said before, there are families that also get through this. Most do. And really what the research shows is that most step families will begin to stabilize, will come out of their different points of crisis anywhere between 2 to 7 years prior to the introduction of a step parent. And every time I put that number out, I think of one family that I had in particular where I had a pre-adolescent who said to me, 2 to 7 years, I'm going to be 7. You can count on that. And that was her perspective. She really felt like this was not working out for her, but she felt that at year 7, things were probably going to be okay. So again, 2 to 7 years is generally what we expect for a step family to have adjusted. Protective factors, they're largely personal characteristics, so personalities that draw out positive emotions from others. So a child that's a little bit more outgoing, more smiley, more engaging is going to be more likely to bond with a step-parent more quickly than another child in the same family who's a little more reserved. Not quite as chatty, likes to do activities on their own, that type of thing. Those with an easy temperament, right? So kids that are easygoing versus others. Again, these can be 2 kids in the same family where one seems to be bonding with step-parent and others do not, and not as quickly, I should say. And it's likely to be some of these personal factors that come into play. Sense of humor. Also likely to draw people in, and intelligence. It's not necessarily that kids need to be of superior intelligence, it's that if they do not experience learning difficulties, the stress of somebody new into their family is not going to be as significant, barring all other things in their lives. Good self-esteem, good coping skills, and I'm sure that none of these are surprising to any of you. So determinants of step-family dysfunction. I've talked about these to some degree already. So combining free time with child and step-parent. Okay? So in an attempt to increase family cohesiveness, many biological parents mistakenly share the bulk of their free time with both child and step-parent. As I said before, obviously it's important. It's important to establish that new family feel and experience some good family time, but again, if it's the expense of the one-on-one time, then it's going to be problematic. And resentment towards the biological parent for fostering the loss of the attention, and towards the step-parent for being the culprit of the change is likely to manifest, again, in behavior problems or overall discomfort for the stepchild. So the question that seems to come across the literature and also for families is to parent or not to parent. And Unfortunately, the general consensus is that it's a delicate balance, that it's different for many, many families. It really depends on what was the communication level before, what was parenting like before. So if parenting for the single family was one way, and then all of a sudden there's a whole new strategy, a whole new way of parenting that's brought in, that's going to require more time than two people that have similar parenting styles. So at this point, there really is not a specific formula, but I'm working on it. So what is the step-parent's role? That's another big issue. Where do you find that balance? At what point do you come in and start making those parenting types of decisions? And again, as I said, there's a real lack of consensus within families regarding that role, and really it depends on largely how the family was functioning previous. So a step-parent that rushes in too quickly to parent is going to lead to problems. A step-parent that doesn't come into play soon enough is also likely to experience difficulty as well, because then when it comes time to laying down the law, they're not likely to be paid as much attention to. Contributors to step-family dysfunction, as I mentioned before, stepfather parenting is inversely related to the degree the child likes the stepfather and mother's negative mood. So, as I mentioned before, the more he's parenting, the more difficulty the children are likely to have. Some people say that the role of stepfather should be as a quiet supporter of the biological mother. That he should really take a backseat role initially until everyone is more comfortable with either new rules or new ways of interacting with each other. The biggest, the biggest factor that seems to come into play is how well parents are able to discuss their parenting issues that come up. So parents will experience difficulty or have differences of opinions on how children should be reared, and stepkids are looking for discrepancies. In intact families, they look for that as well, right? So they're looking for the person who's going to give them the most, right? Who's going to give them, I guess, more privileges, that type of thing. But what we see in step families is that they're really paying much closer attention, and their allegiance is always going to be to their biological parent. So if they're not wanting to have the presence of the step parent there, then they're going to be looking for fuel for that. Having said that, what I also see is that step parents and biological parents will sometimes have arguments and resolve their issues elsewhere. So they'll have a bit of an argument, a difference of opinion, and say, oh, well, I'm going to go have a drive, I'm doing this, something else, and then resolve it later on. So then kids go to bed, they have their discussion. What we see with step kids is that they hold on to that. If they haven't seen how it was resolved, they're going to hold on to that a lot more tightly than a biological child in a general family situation. They're going to be much more concerned about biological parent and are likely to still hold more of a grudge, if you will, for that other parent. So it's important that there be general consensus around parenting to avoid those types of things. So establishing some suggestions, establishing a good relationship earlier on, that makes sense. And the earlier it can be established, the better. Warnings about rigidity of boundaries. So maintaining a certain level of flexibility. Recognizing there's going to be up days, down days. There are going to be times when everyone gets along. There are going to be times when things are not going to go as smoothly. And kind of letting go of some of the general beliefs that are set up initially. Another thing that comes up, and I talked about this a little bit earlier in terms of laws, but there really is a lack of history with a step-parent. And children seem to find that to be quite difficult. If we think about couples starting to date, that type of thing, sharing information about each other, they're discovering their likes, dislikes, that type of thing, whereas kids are not necessarily going to be part of that. So all of a sudden they have this person who's been around, but they aren't going to have the same information that they would have had about their own family. And as I said before, many families seem to avoid sharing family history with a step-parent. Most people are uncomfortable talking about a time when their partner was with somebody else, and how great that may have been for stepchildren. So sharing stories about growing up with, sharing those stories with a step-parent seems to increase the family bond and comfort level for the stepchild. Chances are that much of the individual history won't have been shared, or will have been shared, I guess, amongst the partners, but not with the child. So it's really important to bring that to the forefront, to be talking a fair bit about what was this child like when they were growing up. What were some of the really great experiences that they had? What were some of the really fun family times that were had, even though they may have included somebody else? So I would encourage step-parents to ask more questions, find out more, and don't just assume that you know how your stepchild is feeling or what they would consider to have been a good time or bad time in their lifetime. And what we know is that initially step-parents just simply don't have that same bond as the natural parent. They won't have known the innocence of a stepchild as an infant, nor have the recollection of the child's first steps or first word, or have an idea of the personal struggle that that family may have gone through as they were separating. And it's important to note that children notice the differences, so they're well aware of the fact that you know about the history versus somebody else who doesn't. So mom may parent in a certain way because she's aware of something else historically, whereas stepfather, stepmother may not be aware of something that is important to that child. So a child may become angry with either parent, right? So when limitations are put, sometimes children are okay with that, but oftentimes they're not pleased. With a biological parent, they're able to forgive and move on. With step-parents, what we see is that they start holding a grudge just simply because of that relationship. So building that history and making a point of developing that history, given that it was not already established, is important and has been found to be beneficial. Also, lack of experience in parenting. Sometimes step-parents are coming in cold. Really. They may or may not have had their own kids. And so suddenly putting these expectations on, and also without having the history of that child, can be really difficult for a lot of people. So sometimes just taking a back seat and getting a sense for how is this family run before jumping into things. The other thing is to pick your battles. And this goes across any family situation, right? One of the key parenting pieces. And one of the difficulties I find for step-parents is that suddenly, and I'm going to talk a little bit about this in a couple of minutes, is that they also are stressed. They are also coming into this whole new situation, had their own set of beliefs, and they are losing a lot as well. I remember having one family in particular where the stepmom was so upset because the 6-year-old boy chewed his supper with his mouth open, and this just made her crazy. It was just one of the most difficult things that she was dealing with. And their family was functioning well, how they dealt with many issues, fabulous. But this was an area for her that just drove her nuts. And it ended up being quite a battle. And they would get into it every night at supper, and it was just this one particular thing for her. So again, it's important to recognize, and I remember working with them and thinking, there's got to be something else here, right? There's something else. No, it was that. It was just that, and they were fighting about it every single night. So resolving that type of issue, and we're human, right? We all have little tiny things that bug us. And for her, she was really stuck on that. So taking a step back and recognizing that some battles worth fighting, others you can let go. But it's important to check on those. Because as a step parent, you're coming into this whole new situation, and so there may be little things like that that are really, really bug you. Excuse me. And those are things that you're forced to deal with. I also remember another stepmother would, hope I don't gross out, hair in the shower was a big issue. Her stepdaughter had long, gorgeous, curly hair, and she didn't like that there was hair in the shower in the morning, and so they were having all these issues with how do we deal with that one particular thing. And once that was resolved, it was okay, but it was as though that just pushed that one person to the edge. And again, they were doing well in a lot of other areas. So problem solving, right? Because there's going to be little things that irk step-parents, that irk biological parents, and also adolescents. So as I said before, these people are being thrown together. So there's the two, romantic duo, and then everyone else is expected to suddenly function. So it's important to recognize that there are some factors there that, that are stressful and irritating as well. So I've talked a bit about this, and I'll try and speed up so I can get through this, but I'll focus right now on step-parent loss. Loss of personal time. That's a big one. They're likely to experience loss of income as well. They may suddenly be sharing income with the rest of the family. Some people are more comfortable with that than others. Loss of close relationship with a partner. Not that it's lost entirely, but the emphasis is likely to be on children, on stepchildren, more so than it would have previously if the step-parent didn't already have their own children. There's going to be an increase in day-to-day discord. Right? As I said, everyone's going to come down from that honeymoon phase, and as everyone's trying to sort out the intricacies of their relationships and of that family day-to-day functioning, that's hard and that's stressful, and that's going to be something new that step-parents are likely not to have experienced beforehand, certainly not on a day-to-day basis. And as I said before, new irritants, new pet peeves, chewing at the table, other things that may drive you nuts. So really important things to hit on. Devising a new role for step-parents. So having expectations such that we're not going to fit straight into a full-on father, full-on mother role. Those expectations are far too high, and it's going to set you up for failure, especially if they're done earlier on. Excluding the step-parents entirely, I've seen families in that situation as well. That's also problematic. There is a delicate balance there, and the difficulty is working equally on both. Can-I parenting versus house rules parenting. This is the difference that I make for quite a number of years initially for step-parents. Can-I parenting goes to biological parent. Okay? The reason for that is that they're trying to get something from the parent. So if the stepfather, stepmother is making the decision out of the blue, that child is going to be more likely to have difficulty if it's coming from step-parent versus biological parent. House rules parenting, fair game for anyone. So rules where children have the general expectations. They know these are the rules. So step-parent is enforcing those rules. So it's nothing new. But the can-I parenting seems to be one of the most difficult things for kids to adjust to, because they don't understand why this new person is able to make all of these decisions for them. So I generally remove them for the first few years entirely. It's not, I guess I should qualify that. I don't want kids calling parents at work. Right? Mom's at work, we're not, can I eat this? Can I have that? Right. I'm talking about broader things in terms of privileges. Can I sleep over? Can I go to the dance? That type of thing should go through mom or dad, whoever is the pre-existing parent. So basically, for the first few years, step-parent role is going to be the adult in charge, right? So they're going to enforce general parenting in terms of what they see in their presence. So obviously they're not going to call and say, oh, so-and-so, hit little Joey over the head with his train today, what do you think I should do, right? So there'll be certain areas that are covered across both. But as I said, the can-I parenting seems to be the biggest one. And if it's removed initially, things seem to go a lot more smoothly, especially with adolescents at that point. And not to say that it needs to be taken off the table entirely. Entirely, as in during entire development, but certainly initially. if at all possible. So as I mentioned before, although increasing family cohesion is an important piece, maintaining that one-on-one time. One-on-one time initially with biological parent, and then also one-on-one time with the step parent. Finding something that step parent and child can do together. And again, it doesn't have to be the trip away for the weekend at a spa. But if there's anything that they have in common at all, reading a similar book, going for a walk, their favorite show, but where biological parent is going to remove themselves as well. It really needs to be one-on-one time. Again, with the biological parent and also with a step parent. And it also doesn't need to be for long periods of time either. 10, 15 minutes, 20 minutes, playing a game that they really like, that type of thing. Another factor that seems to help improve relationships is reinforcing the marriage. So when issues come up, supporting the marital relationship and supporting parenting issues, because this is going to be a little bit more difficult for step families because they're going to be coming from completely different directions, and some will have had histories with children and others not, and so it really becomes a lot more difficult in terms of sorting out parenting issues, parenting differences, and increasing communication within the entire family. So sorting out what ways you can do that. What's worked in the past, what hasn't worked. And as I said before, when step families come in, I'm still more likely to do some work initially with the biological parent first to get a sense of where were you guys before a step parent was introduced. How did you handle things before? What are the strategies you're likely to use? What's worked for you? What hasn't? That type of thing. And then I can add in the additional step parent piece. Oftentimes, the difficulties were pre-existing. And families are just simply in need of new ways of coping. Other suggestions: reduce pressure, reduce expectations for family functioning. I would say that for the first 1 or 2 sessions that I have with step families, I spent a lot of time on this. Really just taking a deep breath and realizing that you're supposed to be having difficulty. You absolutely are. And there would be problems if suddenly you were this perfect family all of a sudden that just matched and everyone got along and it was great, right? It's just not what we generally see. And it becomes more disappointing for step families because they started out with that initial honeymoon phase and that initial desire to have what they perceived as a loss beforehand. So they felt as though they weren't complete, possibly, and they felt as though this piece was missing, and so now expectations are quite high. So supporting each other in terms of parenting decisions. As I said before, being on the same page in terms of that. And note that stepchildren are watching you more closely than biological children, and they're looking for those discrepancies. Not that biological children aren't, but stepchildren seem to be a little bit more vested in that. If parenting issues do come up, try and work them out, if you can, in a generally public way. I don't mean for you to be having a full-on argument in front of your family, but if you're resolving an issue, allow your stepchild to be aware of how it's been resolved, that you have, come to a conclusion, that type of thing. Because if they miss that piece, then they're more likely to hold that grudge longer. Because again, they don't have that experience with that step parent. As I said before, choose your battles, choose your battles. I'm not going to say anything more about that, but very important. Try to increase communication as well. I always recommend talking through things in a boardroom setting. When I initially used to use this description, the apprentice wasn't out. So it was a little more salient then. In boardrooms now, kids have seen significant arguments take place, so it's not quite the example that I used to give. It doesn't quite approximate what I'd like to see, but I generally inform kids that when there are difficulties, when we are going to have communication problems, let's sit around the table. And generally speaking, when people are at work, they're not going to be screaming and yelling and have huge emotional outbursts. They're going to come to the table, and I tell kids, put it on paper. What are your main issues? What is it that you're needing? What is it that you're not getting? If they can do that. And then everyone comes to the table and tries to talk about it in a calm way. When this is done well, and if the family is able to do this, if they're at a spot where their communication was still high enough that they can do this effectively, it seems to help a lot. It really allows for all of the communication to settle in a really nice way. Learning to accept the differences rather than fight them. As I said numerous times today, we're all unique, we're all different, we all have our quirks, we all have our irritants, that type of thing. And you know, step families are more prone to experiencing these because, as I said before, new family, these are new people that are suddenly put together. And so they have to learn about what are the differences, what are the things that they like and dislike. So making sure that really you're taking these in stride. Another important thing is talking about step family vision. What would everyone like to see? What would your step family look like? It's important to do this after the honeymoon phase. So okay, we all had this view, these ideas of how everything was going to be so great, but now that we are who we really are and we see who we really are, what would we see for ourselves? Is it realistic to think that we're never going to fight? Nope. Is it realistic to think that we're always going to interact in the best possible way that, you know, that we can? That would be nice, but chances are no. So it's important to really set a general groundwork. So I mentioned before, talking about the history. Where did the child come from? What are they used to? What do they love? What was their family like for them? Have them talking about that, getting out the albums. As I said before, some step parents find that really, really difficult. It was a time when they weren't there, when there was another woman, there was another man that was part of that family, and that's tricky. That's tricky on a marital level, absolutely. But it is more beneficial to the child if that barrier can be transcended. I don't know what I'm trying to say here. Yes. So now on the other side of that, it's important to also set up the step family vision. Okay, so this is where we've been, this is where you've been, where are we going now? So kind of developing a new family story, a new way of thinking that incorporates the entire family. So talking about family values, family rules, really before problems arise, when you can. And setting the groundwork in advance has been shown to be very effective. Final conclusions are, well, generally speaking, that stepchildren are at risk. They're at risk. Do they all experience tremendous difficulties? Absolutely not. The general consensus is that there are periods of time that are better than others, and that most stepchildren are going to go through some form of disruption or another. They are a vulnerable population, even though there are individuals that do quite well. Generally speaking, we do see that when you compare step families, especially during those initial times when they're coming down from the honeymoon phase, they do fare less well than intact families and even single-parent families. So really, I think we need to do more research aimed at finding some of those protective factors. What are some of those other things, other factors that we can really bolster among those step kids? And then also develop really a general step family program. So looking at what specific parenting strategies work. Are there some parenting strategies that we use right now amongst our intact families that don't work, that don't quite fit as well for step families? And my next step is to continue seeing step families in clinical practice, and also to continue work in this area, devising more specific step parenting strategies and step parenting program.